Hi guys, how are you? I hope you are all well. Today's my topic of discussion is about the parietal lobe. In previous video, I briefly explained the frontal lobe, its functional anatomy. Okay, now in this lecture, I gonna explain to you the parietal lobe, its boundaries, its functional anatomy. Okay, so let's I draw the picture of the brain. Guys, you know this is the central sulcus of the brain. This is the lateral sulcus of the brain. This is the parietal occipital sulcus of the brain. Parieto-occipital sulcus. Okay. So I have to label it. First one is, what is this sulcus? This is central sulcus. Second one, this is the lateral sulcus, which separates the frontal lobe and parietal lobe from the temporal lobe. And this is third one is the parieto-occipital sulcus. Okay, parieto-occipital sulcus. So first, today's my topic of concern is about this area, which I highlighted. This area. I tell you about the functional anatomy, its borders. So guys, the borders of this area are clear. This is the parietal lobe, which I draw. This all the parietal lobe. Okay, the border of the parietal lobe, if I change the color, yes, so the anterior to the parietal lobe, this is central sulcus. The inferior to the parietal lobe, this is lateral sulcus. And posterior to the parietal lobe, this is parieto-occipital sulcus. And superior to the parietal lobe, this is the bone, parietal bone. Okay, so these all are the borders of the parietal lobe. Now let's talk about the functional anatomy related to the parietal lobe. Okay, so I have to clear the boundaries of the parietal lobe. Now I tell you the what I tell you the I tell you the functional anatomy of the parietal lobe. So I again draw the brain. This is our brain. Okay, this is the central sulcus. This is the lateral sulcus. Okay, and this is the parieto-occipital sulcus. So first area I gonna draw this area, this area which is present posterior to the central sulcus. This area, this highlighted area, this area. What are the name of this area? This is primary somatosensory cortex area. What is this area? This is primary somatosensory cortex area, which is basically receive the conscious awareness of somatic sensation all over the body. So this area is basically response to the sense. Okay, we have a body and we have a receptor all over the body for the somatic sensation. So all the somatic sensations comes from the body towards this area. So this is the primary somatosensory cortex. Second area, which is highlighted here, this area which is posterior to primary somatosensory cortex. This area, what are the name of this area? This is the somatosensory association cortex. Okay, second one is somatosensory association cortex. Okay, first one this, second one this. Okay, now the third one area, which is the basically participate in the other lobes also. For example, I draw this area. This is the third lobe which participate a little bit to the posterior, little bit to the temporal, and this area. Okay, this is the third area which is present anterior to the parieto-occipital sulcus. Okay, this is the third area. What are the name of this area? Very important name. The area is posterior association area. This area's name is posterior association area. Okay, now these are the parts of the functional anatomy of the parietal lobe. Now I explain a little bit its functions. So the function of the first one is, which is the primary somatosensory area, is conscious awareness of somatic sensations. Okay, the second one, which is here. Okay, the second one, this area is somatosensory association area. So what are the function of this area? If I talk about the functional anatomy, we must know the functions of it. So what are the function of the second area, which is somatosensory association cortex? Is analyzing, recognition, memory, storage of the somatic sensation. Analyze the data, recognize the data, confirm the data. For example, if I give you example, I close my eyes and I can hold this pen. Okay, I don't know what is this, but I feel it and I recognize it, this is like a pen. Okay, so all this recognition, analyzing and memory storage sensation are comes from this area. All these the second area. Okay, and the third one is posterior association area. Posterior association area participated parietal lobe. Okay, I can highlight it here. Parietal lobe. Okay, okay, this is the parietal lobe, posterior parietal lobe, a little bit occipital part. Okay, a little bit temporal part. Okay, three areas. So third part consists of three areas. What are three areas? There is a parietal area, posterior parietal area. There is a occipital. This is the occipital lobe which is present posteriorly. This is the, this is all occipital lobe. Okay, so this part is related to occipital lobe, and this part, this area is temporal lobe. So this part of the parietal lobe is associated with temporal lobe. All these three parts collectively collect the information. Okay, and all these part collect the information and send information to the frontal lobe. Okay, this is the prefrontal cortex, like this area. And for the sensation, okay, from the hearing sensation, for example, something some for example, some hot water fall on you, okay, on your body, you can hear something fall on you, you can see the burning, you can feel it, like this. All this sensation goes to the primary prefrontal cortex from these three areas. Okay, so these are the three parts of the functional anatomy of the parietal lobe. I tell you the boundaries, I tell you the functional part of the parietal lobes. Okay, guys, please watch the previous video. I clear about the frontal lobe and its functional anatomy. Now in this video I gonna explain to you the functional anatomy of the parietal lobe. So guys, be support and be like and share and comment, and please comment related to my video. Okay, ask some questions related to it, like this type of questions. Okay, so guys, goodbye, take care, and please watch my video, share, subscribe, and must press the bell icon to receive the new video and its notification. Okay guys, goodbye.